Allopathic medication, part 3. The controversy surrounding the term can be traced to its original usage during a heated 19th century debate between the practitioners of homeopathy and those they derisively referred to as allopaths. Hahnemann used allopathy to refer to what he saw as a system of medicine that combats disease by using remedies that produce effects in healthy subjects that are different, hence the Greek root allo, different from the effects produced by the disease to be treated. The distinction comes from the use in homeopathy of substances that are meant to cause similar effects as the symptoms of a disease to treat patients. Homeo meaning similar and pathy meaning the disease. So, homeopathy meant treating of the causes of disease, and allopathy meant treating of the effects. Of course, it was a false name given to a medication, and those who received such a title felt bad about it, retaliated to it. As used by the homeopaths, the term allopathy has always referred to the principle of treating disease by administering substance that produce other symptoms when given to a healthy human being than the symptoms produced by a disease itself. For example, part of an allopathic treatment for fever may include the use of a drug which reduces the fever, while also including a drug such as an antibiotic that attacks the cause of the fever, such as a bacterial infection. A homeopathic treatment for fever, by contrast, is one that uses diluted dosage of a substance that in an undiluted form would induce fever in a healthy person. These preparations are typically diluted so heavily that no longer contain any actual molecules of the original substance. Hahnemann used this term to distinguish medicine as practiced in his time from his use of infinitesimally small or non existent doses of substances to treat the spiritual causes of illness. The companion encyclopedia of the history of medicine states that Hahnemann gave an all embracing name to regular practice, calling it allopathy. This term, however imprecise, was employed by his followers and other unorthodox movements to identify the prevailing methods as constituting nothing more than the competing school of medicine. However, dominant in terms of number of practitioner, proponent, and patients. Contrary to the present usage, Hahnemann reserved the term allopathic medicine to the practice of treating disease by the means of drugs inducing symptoms unrelated, that is, neither similar nor opposite to those of the disease. He called the practice of treating diseases by the means of drugs producing symptoms opposite to those of the patient an enteopathic, from the Greek word evoric, meaning opposite, or an antipathic medicine. So, calling it an antipathic medicine. Well, if we talk about allopathy currently in the days today, we found it as the most successful form of the medication, prevalent all over the world, having universities and colleges granting degrees in allopathic medicines, while the antagonists of allopathy are not even seen in the pages.